Diabetes mellitus, a common endocrine disorder in dogs, often requires lifelong insulin therapy to regulate blood sugar levels. While insulin is crucial for managing this condition, achieving optimal glycemic control can be challenging. There's always a quest to refine treatment strategies and improve the quality of life for diabetic dogs. Sodium glucose cotransporter 2 inhibitors, or SGLT2 inhibitors, have gained recognition in human medicine for their ability to lower blood glucose by increasing its excretion in the urine. These medications work in the kidneys, specifically in the proximal renal tubules, where they block the reabsorption of glucose back into the bloodstream. By inhibiting this reabsorption process, more glucose is eliminated through the urine, leading to a reduction in overall blood glucose concentrations. The beneficial effects of SGLT2 inhibitors have been observed not only in humans with type 2 diabetes but also in diabetic cats, and as an additional treatment in humans with type 1 diabetes who also require insulin. However, the use of these inhibitors in insulin-treated diabetic dogs had not been well documented prior to this study. While SGLT2 inhibitors hold promise, they are not without potential risks. One significant concern in both cats and humans is the development of diabetic ketoacidosis, or DKA, a serious and potentially life-threatening condition. Interestingly, this risk might be heightened if insulin administration is reduced or stopped while using these medications. The mechanisms behind this increased DKA risk could involve reduced kidney excretion of ketones, an increase in glucagon secretion due to lower blood glucose, and the inhibition of sodium glucose cotransporter 2 in specific pancreatic cells, and the breakdown of fats for energy linked to weight and calorie loss. While some concerns about acute kidney injury in humans have been debated and largely refuted by major studies, other risks associated with SGLT2 inhibitors include dehydration, urinary tract infections, and fungal genital infections. This study provides valuable initial evidence that the addition of canagliflozin to insulin treatment in dogs with naturally occurring diabetes can significantly lower interstitial glucose levels, likely through increased glucose excretion in the urine. However, it also highlights the critical need for careful monitoring and potential insulin dose adjustments due to the increased risk of hypoglycemia. Any reduction in insulin dosage, especially when combined with canagliflozin, requires close observation for clinical and biochemical changes, including monitoring ketone levels to detect any early signs of DKA.